Good afternoon, and thank you so much for the opportunity to be here. I would like to speak with you today about medical cannabis for children, and especially children with autism spectrum disorder. I have no disclosures, but the randomized study that I'm going to present is sponsored by BOL Pharma, which also supplies medical cannabis for the study. Okay. It seems that in the everlasting debate regarding marijuana legalization, in many places, the current public opinion is turning toward legalization. I think that it might be that in a few years from now, M will not stand for a fast food chain anymore. I think that one of the consequences for the increasing popularity of recreational cannabis is also the current hype of medical cannabis. As cannabis is a plant, a natural substance, it's gaining a positioning of a safe and innocent substance as opposed to the evil chemical drugs, as you heard in the former lecture. I think that among physicians, even medical cannabis is somewhat less popular. And the fear of physicians from medical cannabis is much more prominent when we deal with children. And for a very good reason. Cannabis has a significant impact on the brain, and the brain of children is a construction site, so we are right to be worried about any interference. With cannabis, it's not just a vague fear. There is evidence that consumption of recreational cannabis at a young age is associated with certain risks. There is a risk for addiction. In adults, 10% of cannabis users will develop addiction. In children, the risks are higher and might reach 50% with the daily use before the age of 18. Cognitive decline, a mild decline I must say, appears after years of chronic cannabis use in cannabis smokers who started smoking before the age of 18. The more prominent problem with chronic cannabis use in youth is a decreased motivational loss, a decrease in our ability to raise enough willpower to fulfill one's goals. And most frightening is the risk for psychosis and schizophrenia, which although relatively low, is still 3 to 6 times higher compared to the general population. So why take unnecessary risks and give medical cannabis for children? I have two answers for this question. First, the risks with the specific strains that we give to children are considered low. And second, these relatively low risks are definitely not unnecessary, and I will explain both claims. The cannabis plant contains many cannabinoids, as you heard, and the two main cannabinoids are CBD and THC. I'm sure that you are all familiar with by now. And both CBD and THC are neuroactive. They impact the brain, but they do it in completely different ways and even contradicting ways. The THC is the main psychoactive substance. It causes the high feeling. It is the very reason why so many people are using cannabis. But the THC can also cause anxiety, and it is also the cause of all the risks that I have mentioned earlier. The CBD, on the other hand, is not psychoactive, and it can also decrease anxiety. It's an anxiolytic, it's antipsychotic, and it can also decrease all the risks that are associated with the THC use. There are countless different strains of cannabis, and each strain impacts the brain in a different way. The most important factor is the relative concentration of the THC and the CBD. Most medical strains, and of course all recreational strains, are very high in THC and very low in CBD, and these strains are indeed not recommended for children. For children, we use strains that are very high CBD and very low THC, and these strains are considered safe. So the risks are not high. I want to, in the next minute, I want to show you that these relatively low risks are definitely not unnecessary. So there are two main indications for CBD-rich medical cannabis in children. The first indication is epilepsy, which I will briefly describe next, and the second indication is autism. So we will start briefly with epilepsy. 30% of the children with epilepsy do not respond well to medications and continue to have seizures despite a proper medical treatment. With epilepsy, we already have a proof for the efficacy of medical cannabis. This paper was published 10 months ago in the leading journal of clinical medicine, in the New England Journal of Medicine. 120 children with Dravet syndrome, it's a genetic syndrome with refractory epilepsy, have been randomized to receive either CBD or placebo. The physicians, the patients, their caregivers didn't know who received placebo, who received CBD, and patients who received placebo, there was a treatment with CBD resulted in a reduction of more than 50% in the number of seizures. Treatment with placebo didn't significantly alter the number of seizures. So for epilepsy, we already have a proof, and as a result, more and more physicians over the world are currently starting to prescribe medical cannabis for children with refractory epilepsy, though many still oppose it. Autism is the second indication, autism spectrum disorder. Autism spectrum disorder is defined by the DSM as a neurodevelopmental disorder that begins at a young age and include a combination of symptoms from two subgroups, social communication and repetitive behavior and restricted interest. The incidence of autism is rapidly growing, and today in the United States, 1 out of 68 children is diagnosed with ASD. In Israel, is roughly the same. Unfortunately, 50% of children with ASD have severe behavioral difficulties, tantrums, children who throw themselves to the floor and scream even when they are 17 years old, weighing 100 kilograms. Some children have severe anxiety that prevents them from getting out of the room. Others have outbreaks of severe self-injury or severe violence towards themselves or others. Many children have ugly scars on their forearms because they're constantly biting their forearms. So it's a severe problem. And unfortunately, 40% of children with these problems do not respond well to the standard treatment and continue to have severe behavioral problems despite proper behavioral and medical treatment. Which brings us to medical cannabis. So currently, as I have said, there is a real hype about medical cannabis and autism. If you will Google it, you will find a lot of information, parental reports, many parental reports of families who report that it has helped them, designated sites, designated parental groups, etc. On the other hand, if you are looking on medical studies, clinical studies, currently there are nothing yet. There are several preclinical studies, though. Several studies suggest that imbalance of the endocannabinoid system underlies the autistic behavior in animal models of autism. I will explain this sentence. So the endocannabinoid system is a biological system that all mammals have. It can respond to phytocannabinoids, which are components of the cannabis plant, as well as to endocannabinoids, which are natural endogenous compounds that the body produces and have a similar impact on the brain. So alterations of the endocannabinoid system have been found in several animal models of autism, of ASD. Monogenic models, polygenic models, and environmental models. In some of these models, the researchers were able to reverse the autistic symptoms by activating the endocannabinoid system or by treating the mice with phytocannabinoids, such as cannabidiol, CBD. I must say that all these preclinical studies are still preliminary, and different models give different results, and of course, we are not able to use these studies for the treatment, but we had many parental reports, and by the end of the day, We've learned that the parents are usually right, so we have decided to start an observational study. In this study that was started about 2 years ago, we have selected only children with severe behavioral problems. You know, even today, autism is not listed in Israel as one of the indications for medical cannabis. Back then, like 2 years ago, it was much more difficult to get a license in this indication. So we have applied only for children with severe behavioral problems, of course, after failing of numerous medical treatments, and we've given all those children CBD-rich oil. All the parents rated their child improvement or deterioration in behavior, anxiety, and communication using the caregiver global impression of change scale. This is a 7-point scale, either no change, slightly improved, much improved, very much improved, or slightly worse, much worse, or very much worse. All parents also completed validated questionnaires on behavior, parental stress, and side effects. We have summarized the results of all children who received their licenses before February 1st, 2017, after at least 7 months of treatment. 60 children, average age 12 years. Most of them are boys, of course, 83% are boys, as autism is, and 77% were low functioning. 13 children had a known genetic syndrome or a history of severe prematurity. All children, of course, met DSM-5 criteria for ASD at the time of the treatment, and all had severe behavioral problems based on the clinical global impression severity scale. I think that bearing in mind that this is an uncontrolled study and placebo effect must play a role, it is still impressive that in 80% of cases, a significant reduction in the behavioral problems, in the behavioral symptoms was reported, at least 25% reduction in the symptoms, fewer or shorter outbursts. In 62% of cases, the parents reported that their child either much improved or very much improved, a considerable improvement. Of note, a considerable improvement was also reported in nearly half of the cases in the communication difficulties, which are the core symptoms of autism. And you must know that to date, there are no effective drug treatments for the core symptoms of autism. In the anxiety, 40% of parents reported a considerable improvement, but a third of the children didn't have significant anxiety symptoms to start with. So most children with anxiety considerably improved following the treatment. Also in the questionnaires, all parents completed validated questionnaires on disruptive behavior, and as you can see in both questionnaires, there was an average improvement of about 30% in the behavioral scores. Side effects. So there were many side effects, but most of them were relatively mild and transient. In all cases, the side effects were transient. One child had a psychotic event. We think now that children with ASD are more prone to have psychotic events with the THC, so we are more cautious. But with the CBD, we almost never see it. So the first results in this observational study are promising, but as I said, it's an uncontrolled study, and we should be very cautious with the results. 20 years ago, there was a really similar hype with secretine in autism until a randomized study showed that it was all a placebo effect. And for this reason, we are conducting now a randomized study. This is a relatively large study with 150 participants, a double-blind, randomized placebo-controlled study with crossover. The study includes detailed baseline evaluations and closed monitoring. The overall study period is 32 weeks. There are 2 treatment periods. Each treatment period is 12 weeks with 4 weeks for washout after each treatment period. The baseline assessments include detailed evaluations of the child communication difficulties and the child general functioning using the EDOS and the Vineland assessments. There are also subjective assessments by physicians, parents, teachers at the onset and end of each treatment period, and we monitor for behavioral problems, parental stress, and side effects, of course, every 4 weeks. There are 3 treatment options in the study. The first option is placebo. The second option is whole plant extract, everything that in the plant, of a strain called Topaz, which contain 20 times more CBD than THC. And the third option is pure cannabinoids, 99% pure CBD and THC in the same concentration as in the whole plant extract. The reason that we use this option is to see if there is really an entourage effect, or maybe pure cannabinoids might help, as we found in epilepsy probably. So there are 3 treatment options and only 2 treatment periods, and each participant is randomized to receive 2 out of these 3 options. In collaboration with Dr. Yossi Tam from the Hebrew University, we are measuring markers of the endocannabinoid system in the patient's blood in order to understand whether there is a correlation between the treatment response and the activity of the endocannabinoid system. In collaborations with Professor Dedi Meiri from the Technion, we measure the cannabinoids, the phytocannabinoids levels in the patient's urine. And as far as progress is concerned, this study was launched in January 1st, 2017, and 141 out of 150 participants have been recruited so far, and the 9 that are left are scheduled to start participation in the next weeks. We estimate to have final results by the end of this year. Among these 150 participants, 32 are girls, 21%. This is a relative prevalence of girls in the ASD population. The average age is 12 years. The range is between 5 and 21 years. ASD symptom severity, according to the CARS assessment, most children have symptoms in the high range, 75%, and accordingly 73% had used modules 1 and 2 in the EDOS assessment. Okay, so this study is a double-blind study, and we don't know, of course, which participant received which treatment in each treatment period. But we do know that in most cases, in patients who already finished the study, the parents reported a considerable improvement, at least in 1 treatment period. In almost all patients that completed the study, all but 1 of about 60 patients who already completed the study, have asked to continue with the treatment with medical cannabis after the study was finished, and we have applied, of course, for a regular license for them, and they are currently being treated with commercially available medical cannabis. So actually I want to say that the main challenge in this study was the phone calls from parents, even teachers, during the washout period, asking us to break the rules only once, only for them, and to continue with the treatments that help their child so much. It was difficult for us. We were trying to explain that in the long run it is better for them to know that this treatment is actually working and to be able to receive it for years to come. So the study is receiving a lot of public attention, and similar studies are emerging. Are we there yet? Of course not. But we believe that this is only the first of many studies that will assess medical cannabis in children with autism. And hopefully in the next few years we will be able to tell which cannabinoids mix, maybe terpenes, flavonoids, are preferred for which subtype of ASD, and for what reasons. So thank you very much, and I am on time. Thank you.